This is Dr. Raj Banerjee, and in this video we're going to talk about sluggish thyroid and how low cofactors can cause that. So what are cofactors and why is it important to your thyroid health? Cofactors are things like trace minerals, vitamins and things like that. And the reason they're so important to your thyroid health, the thyroid hormone, is because they are the building blocks of what these hormones are made of. So if you are noticing that you have low thyroid, low TPO, thyroid peroxidase, you may want to start looking at the cofactors. And again, cofactors are trace minerals and vitamins and things like that. So some examples of these minerals are things like selenium, zinc, magnesium, niacin, these kind of things, okay? So there are actual supplements that will have all these cofactors that you can take, and we use them in our clinic actually. Now the reason that we don't include tyrosine or iodine when I help people with thyroid issues is because many of these actually will contain the iodine. And the old school thinking is, you need a lot of iodine for your thyroid to work. What we have found in our clinic is that if you have Hashimoto's, if you have low thyroid, again, 90% of low thyroid will be an autoimmune issue, putting iodine or tyrosine can actually flare things up even more. It's almost, one of my mentors mentioned that it's kind of like putting gasoline into the fire. So the inflammation in your body will just be more and more. So we don't really want to do that because it's going to actually make the patient worse. And so a lot of these patients will come to me, they've been to other functional medicine doctors and they said, the doctor has told them to take these iodine supplements and things like that, and things are getting worse. So again, the reason that we don't do tyrosine is because it's a very popular thyroid support amino acid. What it does, it actually increases the epinephrine and norepinephrine. So these are called catecholamines, and what that means is that they actually will they can actually further suppress the TPO activity, and obviously that's something that you don't want, okay? So again, the whole idea is to really figure out the triggers that's actually causing your thyroid to not work in the first place. And so the right testing needs to get done to even do that. So also you need to have proper support for your thyroid activity, and that could come down to simply getting the right specific cofactors that we just mentioned. And there's blood tests that you can do for magnesium, there's blood tests you can do for vitamin B, for zinc and things like that. So you may need these minerals and these cofactors to make your body work better, okay? And again, instead of just haphazardly kind of just taking all the sorts of vitamins, it's a really good idea to get the right blood test done so you know what you're deficient in. So for example, if we do a magnesium test on you and we find out that you're low in magnesium, below 2.0, this is what I kind of look at, then we want to give you certain magnesium supplements. And one of the best ones that I've found is either a spray or a cream that you just put on vascular areas, usually underneath the foot, and it'll actually get into your bloodstream, absorb into your bloodstream that way. So this is the end of this video, and I just want to leave you with one quick point. And if you get this, you can free yourself from chronic fatigue and pain and depression and overweight. The female hormones do not all of a sudden malfunction by themselves. They are responding to stress as a stress hormone called cortisol. Every molecule of cortisol that you produce comes from progesterone. When under stress, guess what happens? Your cortisol goes up and your progesterone drops. So what you need to do is you need to figure out what your cortisol level is and fix it. And throughout these videos, I'm going to show you the whole physiology of the female hormones and what you can do to actually get the results that you're looking for so you don't have these crazy symptoms. That'll help you eliminate depression, fatigue, night sweats, hot flashes, mood swings, all that stuff we just talked about. And it'll improve your metabolism so you're able to actually start to lose weight again. This is Dr. Raj Banerjee. Thank you for watching this video, and stay tuned for the next one. Please make sure you like my video and also subscribe to my channel so I can continue to make these kind of videos for you. Your support is appreciated. Leave a comment down below letting me know what kind of other videos you'd like to see so I can make them for you. Thank you so much, and please visit my site, getleantoday.com.